Go to the State Health Plan webpage, shpnc.org. If you leave early, please come up front and grab something from the front table. And right here, your new health portal. So you just click on that, and it takes you directly there. You'll click Create an Account, and it's really easy to set it up. All you have to do is type this information in. The next screen will ask you for a password so that you can come back in the future. So this is basically what it looks like when you log in. The percent. Okay, I was about to say. So when you log in, this is what your personal health portal looks like. And then when you get there, just tons of resources. This is your navigation bar right here that can get you to the various aspects of the site. And I want to point you to completing your health assessment. It took me 10 minutes to complete, and it's what it takes of most people. I got like a few extra questions based off of the way I answered a certain number of few. So 10 minutes is about the time it'll take you to get that. And like I said, it'll pump out a personal health report, and then it'll also tell you where to take action. Eat a healthier diet is what mine was. So I went through and told them a little more about my diet, and they gave me the option for the online digital coaching, and I took advantage of that. What's really cool about this, if you're accessing it, is the Nuval Health Score. Basically, it grades every food from a 0 to 100, a scale that we're all familiar with to some degree. And you can type in the food, whether it's a brand of bread that you want, or it's just a general category. Like I typed in spinach, and spinach gets 100%. So eat your veggies is not a lie, because it's good for you. But you can go here and see how your meal, how you would grade your meal. Make comparisons across. So compare that white loaf of bread to that 100% whole wheat bread, and just see how much better that is for you. It's pretty interesting. And then the Resource Center, which is right here. Is basically a dashboard as to where you can access tons of other things. If reading's not your thing and you'd rather let someone tell it to you or show it to you, there's audio files and video files. There are articles on health topics, and then the tools that are there for it's kind of overwhelming actually how many they offer for you. But to get you on the right track, so if you're interested in staying active, it'll give you the action set, and it'll go through some strategies as to how you can make that happen in your life and things like that. And then your personal health record. I don't think I've uploaded anything to mine. But you can organize everything in one spot. And like I said, this is something you can give your doctor access to via the internet through your personal health portal, or you can print it out and take it with you. So if you're about to go get immunizations because you're going out of the country, print that section of your health report off and say, well, hey, these are the ones I already have, so don't double up on me. It takes the ambiguity out of health and wellness and gives you strategies that you can walk out the door and use immediately, which is something that I really appreciate about this. I encourage you to create your profile in the personal health portal, click around, see what's for you, see what's not for you, and to schedule a call with a health coach to see how they can help and support you in whatever lifestyle changes that you want to make. So that was my little dog and pony show. Okay. As to why it's not covered, I could not tell you. That's more of a question for network operations and the benefit side. If you're familiar with NC Flex, which is a flexible spending account, they do offer vision coverage at a discount and also on a pre-tax basis. So Trish in HR, 966-2027. She'll be happy to answer any questions that you might have regarding NC Flex, state health plan benefits, anything in that regard. NC Flex also offers a flexible spending account, healthcare flexible spending account that I take advantage of. You can apply that pre-tax to basically, it's basically, layman's terms, a 30% discount on all healthcare expenses. So when you go to pay your primary care copay, you can use your healthcare flexible spending account to pay that, and you've basically avoided the income tax on that. So they take it out on a pre-tax basis. Yeah. So if you're, I think that enrollment period is. It's the same time, and then it begins in January. And you choose how much money you want to put in that for the entire year, and it's available immediately, but they take it out on a per month basis. So if you want $5,000, which I think is the maximum, then you get that whole $5,000 your first month, but you pay towards that $5,000 for the whole year. So that's another added benefit to that account. And that's through NC Flex. So if you go, that's the Office of State Personnel.